Okay, this is Health Assessment 3310. This is a head-to-toe assessment. We're going to show you what it is that we expect of you on check-off day, so pay attention and see if there's anything that you know that we missed during this assessment. Hey Luke, how are you today?
Good.
Good, okay. So you're in here, you came in today to get your physical, play football, right?
Yeah.
Okay, well, I'm going to ask you some questions. I'm going to listen to your heart and your lungs and whatnot, and it shouldn't take us very long to do that, okay?
All right.
All right. I'm going to get you to take your shirt off for me, if you will. All right. All right. First thing I want to do is just hold your hands out for me. I just want to look at your skin. Just want to look at the skin, note the color, the vascularity. I want to notice the skin turgor. Make sure that you're well hydrated. Okay. The next thing that I want to do is just want to look at your face. Make sure that your eyes are symmetrical, your eyebrows are the same level, your ears are the same level. Okay. I want to look at your nails. I want you to go like this for me. Put your fingernails together like this. That's called the Shamrock test, and what that tests for is it makes sure that your angle on your nails is less than 160 degrees. Shows that you don't have any kind of respiratory problems. There's no clubbing, there's no spooning, nothing like that. Okay. Also want to make sure that that the color of your nails is good. Check your capillary refills. It should be less than 3 seconds. Okay. All right. Looks good. All right, the next thing I want to do is I want to look at your hair. I'm just looking at the color of it, the texture of it. I'm looking to make sure that it's evenly distributed, that you don't have any absence or any excess of hair. Okay, the next thing that I'm going to do, let me sit up for a second, look here. I'm going to inspect, look through it, noting if there's any bumps, any pain, anything when I'm doing this. Okay, all right, I'm going to palpate your skull. No discomfort or anything. Okay. All right. Okay. All right. The next thing I want to do, now that I've looked at, inspected your face, I want to palpate your face. Just looking for any lesions, any bumps, any tumors, any abnormalities in your skin. Okay. I'm going to palpate across your frontal sinuses. Okay. That doesn't hurt, does it? Okay. If you had a sinus infection, that would hurt when I do that. Okay. All right. The next thing that I want to do is I want you to smile for me. I want you to stick your tongue out, put it from side to side, move it from side to side. I want you to frown for me.
I can't frown.
Oh, there you go. Okay, that's good. All right, puff out your cheeks. All right, when you do that, you are showing me that cranial nerve number 7, which is your facial cranial nerve, is intact. Okay. All right, the next thing that I want to do is I'm going to look at your neck. I'm just looking at it, make sure that it's straight. I want you to drink just a little bit of water for me. Just I want to see you swallow. Just take a sip and then lean your head back and swallow. Okay, very good. All right, that is actually checking for cranial nerve number 10, which is your vagus nerve. All right, I just want to look at your trachea, just looking at it, making sure that it's midline and palpating it. That doesn't hurt, does it? Okay, all right. Okay, the next thing that I want to do is I want to look at your neck muscles. I want you to push your head against my hand here. Okay, then this side, push on it. Okay, now this side. All right, back. Okay, forward. Okay, now I want you to shrug your shoulders. All right, very good. That's checking for cranial nerve number 11, which is your accessory nerve. Okay, now I want to, I'm going to check your thyroid, so I want you just to hold this. And what I'm going to get you to do is I'm going to get you to take just a sip of water, and then when I tell you to, I want you to swallow it, okay? All right. Okay, I need you to put your head down and to the left. Okay, I'll take a sip of water. Okay. All right, I want you to do that one more time. Just hold that water in your mouth. Okay, now I want you to put your head over to the other side and put it down. Okay, now swallow. Okay, very good. All right. Okay, well, all right, let me take this. All right, I want to check your lymph nodes. Okay, you have your preauricular, your postauricular, your occipital. Okay, you have your retropharyngeal, your submaxillary, or your submandibular, your submental. And get you to turn your neck for me. these are your deep cervical chain, your posterior cervical chain, your inferior cervical chain, or superficial, excuse me. I'm going to check on this side. Same thing. Okay, I don't feel anything. They don't hurt or anything. Okay, supraclavicular, and then your infraclavicular. All right, very good. All right, no pain or anything like that. All right. Now that we've listened to or palpated the thyroid, I need to listen to it to make sure that you don't have what we call bruise, okay? Which just means that there would be a clogging of that. All right, I'm going to listen to it with my bell. Okay, just gonna sit there for a minute. Okay. I don't hear anything. While I'm here, I'm going to go ahead and I'm going to palpate your carotids. I'm going to do them one at a time so that you don't pass out. Okay. Then I'm also going to auscultate them. Take a look. Okay. And listen to your temporal. All right, very good. Okay. All right, moving on to your ears. I'm going to do a couple different things with your ears. I'm just going to look at them. They're both set on the same side. They line up with the outer canvas of your ear, so it means that genetically everything is normal. I want you to look at the inside of your ear. I'm going to palpate this first. This is your auricle and your tragus. There's no pain or anything when I do that, right? Okay. All right. Now I want to look at them. What I want you to do is I just want you to lean your head this way for me. Okay? I'm going to pull your ear up and back. I'm going to insert, and then I'm going to look. Very nice. Okay, pearly gray. Okay, you should look tilted this way again for me. Up and back. Okay, good. Okay. All right, we're going to leave this here for just a minute. All right, I want you to stand up for me for a second. Luke, I'm going to check your cranial nerve number 8, which is your vestibular-coccylar cranial nerve, and I also want to check your balance. So what I want you to do is I want you to put your hands out to your side like this. I want you to close your eyes, and I want you just to lift up one foot when you do that. Okay? Just lift up that foot. Okay? Now do the other one. Very good. Okay. And sit back down. I'm going to do a couple different tests. The first one that I'm going to do is called the Weber test. And this is actually checking for bone and air conduction. So when I strike this tuning fork, I'm going to put it on top of your head, and I want you to tell me whether or not you feel it in both of your ears. Okay?
Yeah.
Okay. Kind of cool, huh? Okay. The next thing that I'm going to do is called the Renee test. Now, this test actually does the same thing. But what we're going to check for is that you should be able to hear this tuning fork twice as long as you should be able to feel it. Okay? So what I'm going to do is I'm going to take this one and put it right here on your mastoid process. And I want you to tell me when you stop feeling it vibrate. And then when it stops, when you stop feeling that, I'm going to hold it in front of your ear like this. And then I want you to tell me when you stop hearing it. Okay? All right, so here we go. Okay, it's 8 and 17. And I'm going to do this other side. Very good, 7 and 21, so that's really good. Okay. All right, next thing that we want to do is we're going to look at your nose. I'm just looking at it, it sits in the center of your face. I don't see any bumps, any displacement, any pain or anything, right? Just palpate it. Okay, you lean your head back for me. Don't stick anything in there, I promise. Just want to look at the turbinates. Looking at your turbinates, making sure that they're clear, making sure you don't have a deviated septum. So everything looks okay right there. All right, now what I want you to do is I'm going to occlude this nostril. I want you to breathe in when I do that, okay? Okay. All right, I'm going to occlude this one. I want you to do the same thing. All right, very good. Okay. Now, I'm going to do a smell test, which is going to test your cranial nerve number 1, which is your olfactory. So what I want you to do is just sit here, and I'm going to have you close your eyes, and I'm going to give you a couple things to smell. I want you to tell me what they are, okay? All right, quit cheating. All right, close your eyes. Okay, just tell me what you smell.
Vanilla.
Yeah. Okay, good. All right, got one more to do. Okay, close your eyes.
Big excited.
Yep, very good. Okay. All right, so that's it for your nose. The next thing that we want to do is we are going to look at your mouth. Okay. I'm just looking at the outside, looking at your lips. I can see that that they're pink, that they're moist. Don't see any cracking. Don't see any sores or anything like that on there. You don't have any pain or anything with them, right? Okay. All right. I'm just gonna palpate them. Make sure. Okay. All right. All right. Next thing I want to do is I'm gonna look at the inside of it. I'm gonna get you to open your mouth real wide for me. Okay, I'm just gonna look at the internal structures. Okay, look at your uvula. Say ah for me. Okay. See that uvula go up and down. Okay, I'm gonna check your gag reflex. You got it from this. Okay, very good. All right, you all right? All right, that checks for cranial nerve number 9, which is your glossopharyngeal. Okay, all right. The only thing I'm going to do is I'm going to look at the inside structures. I already saw I looked at your throat. It's nice and pink. Looking at your teeth. Your teeth are intact. Have some fillings. Okay. And we'll look at your Stinson ducts up here. Okay. And can you put your tongue up for me? Up to the roof of your mouth. Okay. All right. Looking at your Wharton specks underneath there. Okay. All right. All right. What I want you to do is I want you to inside your mouth just push against my fingers with your tongue. Okay. And then this one. All right. Very good. Okay. That is checking for cranial nerve number 12, which is your hypoglossal nerve. All right, moving on. We are going to look at, well, let's go ahead and we'll do the taste test first. All right, I am going to make sure that all your taste buds are intact. And what I'm going to do is I'm going to have you close your eyes. I'm going to give you a couple different things to taste. And what I'm going to do is I'm going to put them on certain areas of your tongue. And that's, you should be able to tell me what it is that you're tasting, okay? All right, so go ahead and close your eyes for me. All right. We'll do this one first. Okay, got them closed?
Yeah.
Okay, stick your tongue way out for me. I'm going to go way in the back. Can you tell what that is?
Oh, like cinnamon.
This is bitter, right? Okay. All right, let's try a different one. Okay. All right, stick your tongue back out for me.
Lemon juice.
Lemon juice. Okay, that's also checking your glossopharyngeal number 9 cranial nerve. All right, 2 more and then we're done. I'm sorry. All right. Okay. Put your tongue out for me one more time. Close your eyes.
Sugar.
Okay, sweet. All right, last one.
That's salt.
Okay, very good. All right, and that's also checking your cranial nerve number 7, which is your facial. All right. Okay, now we'll move on to the eyes. All right. When you first came in, do you need any more? Okay. When you first came in, we did your vital signs, or before you got here, the nurse did your vital signs, and we also had you do the Snellen chart. The Snellen chart actually is what checks your far-sighted vision. And yours is 20/20, so it's really good. That is also assessing for cranial nerve number 2, which is your optic nerve. Now what I'm going to do is I'm going to do some tests that I'm going to check for, again, for cranial nerve number 2. I'm going to have you read something. And then cranial nerves 3, 4, and 6. I'm also going to do some tests for that, okay? All right. So the first thing that I want to do is I'm just going to look at this. I'm going to look at your eyes. Just look straight ahead for me. All right. I'm just looking at them from the side. I'm looking at the shape of them. I'm looking at the clarity of them. On both sides. Okay. All right. I want to look at them directly on. Make sure that they, both of them are going to constrict. Okay. Sorry. All right, just look straight ahead and we'll look at your conjunctiva. Pink on both sides. Okay. All right, your pupils are equal. They're round. They do react to light. And we want to make sure that they accommodate. So what I want you to do is I want you to look at this for me. Okay. Now I want you to look at something behind, on the other side of my head. Look at something behind me. Okay. Now look back at this pin line. Okay. One more time. Okay. And back at the pin line. Good. All right. They do accommodate. Now I'm going to do what's called direct and consensual. When I shine this light into this eye, directly into this eye, even though we're not shining a light into this eye should do what we call consent. It should still constrict at the same time. Okay? So you don't have to do anything to be able to tell this. Okay, good. Good. Okay. All right. Just so that I don't forget it, I'm going to have you go ahead and do what this is called the Rosenbaum. And what I want you to do is I just want you to hold it at a comfortable distance, and I want you to read this first line right here.
During the last recession, employment in the healthcare industry grew while total non-farm employment was down by more than 7.5 million. Although growth in healthcare was not as robust as in the previous 2 recessions, the industry still gained 400,000, 28,000 jobs. All
right, outstanding. Okay. All right, so that's the other part of cranial nerve number 2. You remember that balance test that I did earlier? And when I had you put your hands out and I said that check cranial nerve number 8, I forgot to tell you that the name of that test is actually called, oh wow, it just went right out of my head. Give me a second. Romberg, sorry. All right, I had you do the Romberg test with that. We're going to make sure that we say that. Okay. Now we're going to do what we call visual fields. So I need you to stand up, and this is going to check to see how intact your peripheral vision is. Okay. All right. So I need you to cover your eyes. Cover one eye with. It doesn't matter. You can do that one. Okay. Now what I want you to do is I want you to look straight into my eyes, and what I'm going to do is I'm going to bring my fingers up, and when you see them, as soon as you start to see them, and you tell me that you can see them. And you might see them right away, okay? But just make sure that you're looking me directly into the eye, okay? All right.
See them. See them. See them.
Okay, now just keep your hand there. Okay.
See them. See them. See them.
All right, very good. All right, switch eyes. Okay, same thing, just look me directly in the eye.
See them. See them. See them.
Okay, there. Okay, very good. All right, just stay there for me. Now I am going to check your ocular motor movements. So what I want you to do is keeping your head straight. Don't move your head at all. I want you to follow my finger, and I'm going to do it in the form of an H. I just want your eyes to follow the direction that my finger goes. Okay. All right. All right. Very good. Okay. All right. I'm going to shine this light directly onto the bridge of your nose. This is called a corneal light reflex. And what this should do is I should see what we call a sparkle in your eye in the exact same point in both spots in your eyes. Okay? So just look straight ahead. Okay, very good. All right. The next thing that I want to do is called the cover-uncover test. What this is going to check for is This is making sure that, that you don't have lazy eye. Okay, so I'm going to hold this. I want you just to look at my finger. Okay, good. Good, okay. Now, if you did have lazy eye, that eye that I'm covering up, when I take that away, would have gone off to the side. And then I would have known that those muscles were weak, okay? All right, those tests that I just did, the direct and consensual, the visual fields, and the extraocular, those actually were checking cranial nerves 3, 4, and 6. And those are your, cranial nerve is your ocular motor, 4 is your trochlear, and 6 is your abducens. Okay? All right, so that's it for the eyes. Now what I need you to do is we are going to listen to your heart and lungs. So I'm going to do your lungs first. Okay, first I'm just going to look at you. I'm making sure that your AP ratio is 1/2 of your transverse. Okay, look at this. 1/2, and it is. Okay. All right, the next thing that I'm going to get you to do is I'm going to get you to turn around for me. Okay. I'm just inspecting your back, making sure that I don't see any abnormalities or anything like that. Now I just want to palpate. Feel any kind of pain or anything, right? Okay. It's a tickle. Sorry. All right. Now I'm going to put my hands at the base of your back, and I'm going to pinch up just a little bit of skin between my thumbs. So what I want you to do is take a deep breath in for me. Okay. Now let it out. Good. Okay. That symmetrical expansion, it just shows that your lungs are rising and that they are level when you're breathing. Okay. All right, the next thing I'm going to do is called tactile fremetis. This just checks for vibrations. So every time that you feel my hands touch your back, I want you to say 99 for me, okay?
99, 99, 99.
All right, very good. Okay, now I want to percuss. Very good. Okay. All right. Now I'm going to listen to your lungs. All right. You actually have breath sounds on both your front and your posterior, but I'm only going to tell you what the sounds are. I'm just going to listen posteriorly. Okay. These are your tracheal breath sounds. Okay. These are your bronchial breath sounds. These are your bronchiovesicular, and everything else is your vesicular. Okay. No tracheal back here. These are bronchial. These are bronchiovesicular. Okay. And these are vesicular. Okay, so what I want you to do for me, Luke, is I just want you to breathe in and out, but I don't want you to breathe real deep because I don't want you to get lightheaded, but just kind of breathe just a little bit deeper than you normally would, okay? Okay, go ahead. Now I'm going to do it with the bell. Same thing, just breathe for me. Okay, very good. Okay. All right, one last thing I'm going to do is called egophony. What I'm going to do is I am going to touch your back with my stethoscope, and every time that I do, I want you to say E for me. Okay? Okay, go ahead.
E, 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 E.
Very good. Okay. Now, if there would have been anything, if you had had any kind of fluid or anything in your lungs when you said that, I would have heard, it would have sounded like an A to me when you said that. Okay? All right. Next thing I'm going to do is your heart. So I want you just to lay down for me on the bed. Just relax. We'll be going to sleep. Okay. All right. I'm going to look at your chest. I'm going to get down at eye level. What I'm looking for is to make sure that I don't see any pulsations, any thrills, anything like that. I can see your point of maximal impulse because you're thin and healthy. Okay. All right, the next thing I'm going to do is I'm going to palpate. Just want to make sure that we don't have any discomfort or anything like that. Okay. All right, the next thing I'm going to do is I want to mark the valves on your chest, okay? Your heart valves. All right, so the first one that I'm going to find is your second intercostal space, which is on your left sternal border. Okay, that's your aortic. And come over here. Second intercostal space on the right sternal border. There's your pulmonic. Third intercostal space, right sternal border. There's your Erb's point. Fourth intercostal space, right sternal border, is your tricuspid. Okay. And then fifth intercostal space, right sternal border, but mid-clavicular line, is your mitral. Okay, now you have different breaths, or you have different heart sounds in all of these. When I listen to your aortic and pulmonic, your S2, the second sound in your heartbeat, is going to be louder than the S1 is. When I listen to Erb's point, they're going to be equal. And when I listen to the tricuspid and the mitral, your S1, the first sound, is going to be louder than the S2. Okay? All right, I'm going to listen with both the diaphragm and the bell this time again. Diaphragm for just normal heart sounds, and then I'm going to use the bell to listen to make sure you don't have any heart murmurs. Okay? Very nice. All right. While I've got you laying here, I'm going to check the pulses. Okay, I already checked your temporal. I already checked your carotid. Okay, I'm going to check your brachial. Check this one. Check your radial. Your popliteal, I'm going to check them. Check your dorsalis pedis. And then right back here is your posterior tibialis. All right, very good. All right, Luke, just stay there. I'm going to look at your abdomen now. All right, so with your abdomen, I am doing the same thing. I'm just going to look at it. Again, I can still see, I can see some peristalsis with you because you're very thin. Just looking at it to make sure that I don't see any abnormalities. You have a more of a concave stomach. It's nice and flat. You can see the musculature in it. Color is good. Okay. All right, the next thing I'm going to do is I'm going to listen to your vowel sounds. Okay, so using your umbilicus, I'm going to divide this into 4 quadrants. Okay. All right, so we have your left upper quadrant, your left lower, your right lower, and your right upper. Okay. We'll listen to them. Must be. Okay. I hear active vowel sounds in all 4 quadrants. Now I'm going to listen to your arteries, and I shouldn't hear anything unless that you have some sort of an abnormality with them, okay? All right, so I'm going to listen to your aortic. I'm going to listen to your renal, to your iliac, and then your femoral are down there, but I'm not going to listen to them today, so, okay. I'm going to use my bell. Aortic. Renal. Iliac. Okay, next thing I want to do is I'm going to percuss. Okay. Oh, it sounds hollow, doesn't it? Should do that for some. Okay, I'm going to percuss your liver borders so that I know exactly where they are. Okay, so I'm going to come out to the side of your umbilicus and I'm going to percuss up until I hear the sound change. All right, and then I'm going to come down to your 4th intercostal space. And I'm going to percuss back down. Okay. All right. Now I'm going to measure that. It should be between 2 to 4 inches or 6 to 12 centimeters. Okay, and yours is 6.5, so that's good. Alright. Now, next thing I'm going to do is I'm going to palpate. I'm going to palpate really light. Tell me if you have any pain when I do this. Okay. Alright, I want to palpate your liver. No, lay still. Okay. What I want you to do is I want you to take a deep breath for me. Take a deep breath in. Okay, now let it out. Okay. Alright, and I'm going to palpate your spleen. I want you to do the same thing. Take a deep breath. Okay, and let it out. Alright, good. Alright, I don't feel either one of them, so that's good. Alright, so you're in good shape that way. Alright, you can sit up. We're done with the abdomen. Okay, now, all that's left is the kind of fun stuff. So, alright, so now I want to make sure, I'm going to check your neurological status. Make sure you're not crazy or nothing like that, okay? You probably are, but. Alright, so first thing I want you to do is I want you to tell me what your name is.
Luke.
Okay, I want you to tell me where you are, Luke.
I'm in the building.
Okay, and can you tell me what day it is?
Sunday.
Okay, very good. Alright, so you're alert and oriented times 3. Alright, I'm going to give you 3 words because I want to check and see how good your memory is, what we call your recent memory, okay? So I'm going to give you the words dog, cat, and Victoria. Okay, so y'all, I'm going to ask you those later, alright? Alright, now I want to check your past memory. So I want you to tell me what your birthday is.
7/13/95.
Okay. Alright, I want you to tell me what you, I'm going to check your present memory. So I want you to tell me who the president is.
Barack Obama.
Okay. Alright, I'm going to ask you a question and I want you to tell me what you would do. Okay. If you were, if you found a stamped envelope on the street, what would you do with it?
Probably go mail it.
Okay, that's good. Alright, that's making sure that you have sound judgment. Alright, now I'm going to see how good your abstract reasoning is. Okay. What does this saying mean to you? The early bird gets the worm.
It means if you're on time, you usually get the better things.
All right, very good. All right, so you have sound abstract reasoning as well. Okay. All right. Now, what were those words that I gave you?
Dog, cat, and Victoria.
All right. Very good. Very good. Okay. Now I'm going to check your cerebellar function. I want to make sure that that everything is intact there too. You have 3 general and 1 upper and 1 lower functions that I'm going to be checking. Now, I already checked your gait when you walked in. I noticed that when you walked in nice and straight, and you didn't have any, seem to have any pain when you did that. I also checked your balance when I did the Romberg. So the last thing that I'm going to do is I'm going to have you do is called tandem walking. And, what I want you to do is I want you to stand up, and I want you to take heel to toe and just put one in front of the other. Take a couple steps for me, and then I want you to turn around and come back. Okay, very good. Okay, all right. The next thing that I want you to do is I want you to do alternating fingers. I want you to watch me. All you're going to do is go like this with your fingers, go back and forth, do them in a pattern, and then I want you to do them faster and faster. Okay, very good. All right, that's your upper extremities. Now, the last thing I want you to do is I want you to, with each one of your legs, one at a time, I want you to make a figure 8 with your leg. All right, very good. Okay, now we are going to check your sensory and make sure that everything sensory-wise is intact. You're going to do 2 sensory and you're going to do 3 discriminatory. Okay, so the first thing that I'm going to do is I'm going to do what's called light touch. Okay, so I need you to close your eyes for me. And every time that you feel this wisp of cotton, I just want you to tell me, just say yes, okay?
Yes. 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 Yes.
No big deal on there. Okay, very good. All right. The next one that I'm going to have you do is called sharp dull. Okay, so close your eyes for me. This is sharp.
Yes.
Okay, and this is dull. Okay, so I want you just to tell me if it's sharp or dull. Okay.
Dull. Sharp. Dull. Dull. Sharp.
Sorry.
Dull. Dull. Sharp.
Sorry.
Sharp.
It's really not as easy as you think, is it?
Dull.
Okay.
Sharp. Dull.
Okay, very good. All right. Now I'm gonna get you to keep your eyes closed. Okay, and I'm gonna want you to put an object in your put your hand out for me. I'm gonna put an object in your hand. You can feel it, you can move it around in your hand, whatever you need to do, but I want you to identify it for me. I'm keeping your eyes closed.
It's a key.
Okay. All right. Why don't you put out your other hand? Same thing with this one. You don't have to be exact.
That's a coin.
Okay. All right. That's called that's called stereognosis. Okay. Now, I want you to keep your eyes closed, and I'm going to write a letter in your hand, in one of your hands. So I want you to tell me what letter it is.
Wait, maybe that's A.
Okay.
It's upside down.
Okay. All right. I'm going to do a letter in this hand, and I want you to tell me what the letter is.
I'm an idiot.
It's really not as easy as you think it is.
Is that an A?
That's an 8. That's graphesthesia. Okay. All right. Now the last one I'm going to do is called kinesthesia. And I want you to close your eyes, and I'm going to touch your body in different places, and I want you to tell me where I touch you. Okay. Just name. It doesn't have to be exact. Just tell me the general vicinity. Okay. All right.
My temple, my nose, shoulder, arm,
Mm-hmm.
stomach, knee, leg, and foot.
All right. Very good. Okay. All right. Now we're going to check your reflexes. So I need you to relax for me as much as you can. Doing reflexes is kind of hard. All right. You're okay. Just sit right there. All right. I'm going to check. First, I'm going to check your triceps. Okay. Just let it hang. Let it hang. There you go. All right. Okay. Well, do this side. There you go. Okay. All right. I'm going to check your bicep. Just relax. Okay. 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 All right. That's your bicep. I'm going to check your brachioradialis. What I want you to do is I want you to put this arm, just rest on there. Okay, just rest. Okay, do the same thing with this one. Okay, all right, let's work your realis. Okay, do your patellar. All right. Are you sure you got one over here? Look. There we go. All right. Okay, now, one more. This is called your Achilles. And the easiest way to do this is I'm going to have you get in the chair. I'm going to have you turn around and put your knees in it just like this, okay? Good. All right, good. All right, that's all your reflexes. All right, one last thing to do. We're going to check your musculoskeletal system, and we're going to make sure that your muscles and your joints are all in good shape. So you can have a seat. All right. So I just want to look at you. I just want to look at your joints, at your muscles. What I'm looking at them for is I'm making sure that I'm looking for size, for symmetry. I'm wanting to make sure that everything looks like they're equal in size. If you will, stand up for me. I saw your gait when you came in. What I want you to do is turn around for me and just bend over like you're going to touch your toes. Sorry. All right, I'm just checking your spine, making sure that your spine is nice and straight. Okay, all right, stand up for me. All right, I'm going to palpate your muscles in your joints. Okay, I want you to clench your jaws for me. Okay. Check your wrists, your fingers. Okay, all right, you can sit down for me. Check your knees. All right. Okay. Now, I want to check your range of motion. Make sure that you have good range of motion. So I want you to take your arms for me. I want you to put them together over your head. Okay. And I want you to come back out to the side. Stop. Come down. And I want you to cross them in. All right. Very good. Okay. All right. I want you to take one leg at a time, and I want you to extend it forward. Okay. Bring it back. Okay. All right, I want you to lift that leg up while you're sitting on the bed. Good. Down. The other one. All right. Now, I'm going to get you to do this with some resistance, too. Okay? All right, so I want you to put your arms up like this for me. Okay? And I'm going to push in. I want you to push out. And don't be trying to knock me over. All right. Okay, now I want you to pull. All right, very good. Okay. All right, same thing. I want you to push out for me. For sure. No, go straight out, like you're going to extend them. All right, there you go. Okay, now pull back in. All right, very good. Okay, very good. All right, now let me make sure that I got all my cranial nerves. All right, one was your olfactory, which we did, which was the smell. 2 was the optic, which we did with the Snellen and the Romberg. 3, 4, and 6 were ocular motor, trochlear, and abducens, which we did with the peripheral vision. We did with Perla, and we did with ocular motor. 7 was facial, which we did with the taste test. 8 was vestibulocochlear, which we did with the balance and the Romberg. 9 was glossopharyngeal, which we also did with the taste test. And we did that with the gag reflex and the uvula rising and falling. 10 was the vagus, which we did with swallowing. 11 was accessory, which we did with your shoulders and your shoulder movements. And 12 was hypoglossal, which we did with, hang on a second. Oh crap, I can't remember. What did we do with we did with tongue strength. Okay, all right, that's it. Thank you.
Welcome.